In today's video, we are going to be addressing the big concern, which is, does Botox hurt? We're going to do a demonstration of injections, and I'll show you a few different techniques that we use here in the clinic to make things more comfortable. Hi, I'm Becky Wilkins. I've been a registered nurse for over 30 years now, and for the last 25 years I've been building my business here at External Affairs Medical Spas. Our specialty is aesthetic treatments as well as regenerative medicine, and our goal is to bring you all the latest information on these topics. Please like and subscribe and share our videos, and be sure to put comments down below if you have questions about any procedures. So we're about to inject Carrie here, and I just wanted to touch on different measures that we can do to make the procedure more comfortable. Typically, nothing is required. We are using little tiny insulin syringes to do the injections. If we have a patient who is a little anxious, we can use things like a topical numbing cream. We use a benzocaine, lidocaine, and tetracaine. And usually it's just not required for around the eyes. I did put a little bit on her upper lip because that spot's a little bit pinchier. We also have Carrie holding our cute little Restylane lips, okay, so she can squeeze those, and those provide a distraction. And then when we do her lip injection, I'm actually going to give her a little vibration tool that she can use along her jawline, which will also distract the upper lip. Alrighty, you ready to go?
Yep.
Okay. So I am a big believer that comfort, so much of it comes from the injector. So even how we position our hands and how we touch the patient can make things more comfortable. So I'm about to treat her forehead, and you'll see that when I treat it, I'm actually going to pull her skin really taut, and that actually makes it more comfortable for her. So Carrie, raise your eyebrows up again. Good, and relax. So I'm just going to pull really tight and do a little poke here. And raise up again. Good, and relax. And we'll go a little bit over here. So the more I touch her and pull her skin tight, the more comfortable it is. And then I'm just going to zigzag a little bit along her forehead. And again, I'm just doing little 1 unit increments just to gently soften her forehead so that we don't drop those brows down. And now we're going to do in between her brows. So Carrie, I'm going to get you to frown. Good, and relax. So we're going to treat the middle, and again, if I pick it up and pinch as I poke, it's a lot more comfortable for her. Pull again for me. Good, and relax. So again, I'm going to pick it up and poke, and I will treat the tail of her corrugator here. And again, pull one more time for me. Good, and relax. You can see how bulky that muscle is right there. So if I pinch and poke, and pinch and poke. And Carrie, how are you finding that?
Yeah, it's fine.
Okay, on a scale of 0 to 10, 10 being horrible, 0 being
2.
2? Perfect, great. So again, this procedure, it should be quite gentle. Good, and give me that big squeeze again. Good, and relax. So again, if I pull her skin so it's super, super tight as I go in, little poke, that makes it more comfortable. And as I'm doing this, I'm watching for little blood vessels. Okay?
Yeah.
And we're going to treat her bunny lines, just because we kind of want to gently soften everything. So if I'm going to treat this, but not her bunny lines, she might wrinkle up a little bit more. So wrinkle up your nose for me. Good, and relax. And again, I'm going to pull her skin really tight. And turn over for me like that. Great. And squeeze again. Good, and relax. And a little poke. Great. Alrighty, so we're done the upper face, and now we're going to move on to her lip. So of all the areas that we can treat, upper lip is probably the most sensitive. Carrie, I'm going to get you to grab that little vibration tool, and if you place it along the bone, it just provides a good distraction because the brain can only accept so much stimuli. So the brain is focusing on that. So now I'm going to pull her skin tight and do a little poke here. Great. Doing okay?
Mm-hmm.
That's it. Wonderful. All right, so try and pull that chin up again. Good, and relax. And we'll do a little poke here. And a little poke here. Great. So today we used Dysport, Carrie. So Dysport is known to kick in a little bit quicker. Okay. So you should notice over the next few days as you try to pull, gradually it will start to kick in. So Carrie, our big question was, does it hurt? Maybe I'll let you answer.
No, it didn't actually. The lip was maybe a tiny bit of a pinch, but everywhere else I was almost not even feeling it. Almost.
Great. If you enjoyed this video or found it helpful, please hit the like button, share it with your friends, subscribe, and hit the notification bell. And don't forget to leave us comments or questions down below so we can get to know you better.